if you suffer from suboccipital headaches, headaches that start at the base of your skull, right, top of your neck, base of your skull, go up over the top or just ache in this area, go up behind your eye on either side. There's one simple way to treat that. It's called strain counterstrain. So what you do is there's a muscle mass on either side called the suboccipital triangle. There's two places where you might have a tender point in the suboccipital triangle. So what you do is you go to the base of the skull and you follow that up until there's this bone that sticks out called the external occipital protuberance, or the inion. And you move just either side lateral to that, and you'll notice that the muscle starts right there, and oftentimes is exquisitely tender. If you find one of those tender points on either side, now there's a second one, so there's the medial point, or going straight across the skull on that same line, can you find that on the suboccipital triangle on the outside, or the lateral point? If you find that, in this case, actually, we have a medial right, C1, and posterior C1 tender point. So we're going to treat that. So what we're going to do is ask the patient to lay down on their back, ideally without all the extra help, on your back. Okay. So for the sake of showing this or portraying this, I'm going to show you that the tender point, again, here's the inion, here's that inion. If I just go lateral to that, I find the muscle mass, and just on the edge of the muscle mass, there's an exquisitely tender point. It'll be very tender. Okay, I'm going to keep my finger on that, and you can self-treat for this by putting your own finger on that. Then you have to extend your skull. Okay, you have to bring your chin up, side bend your head towards the tender point, and rotate away. Somewhere in there, you don't have to go to the end of the range of motion, but somewhere in there, you're going to find a position that helps turn that off. Now, you can also see that I'm gently putting compression on the head, straight down into the neck. That also helps turn that off. For you at home, if you can do this for 90 to 2 minutes, 90 seconds to 120 seconds, that will help turn that off, right? Try to hold your head right there and remain still. Don't let any other thing distract you. So if you can hold that, that'll help with those suboccipital headaches and ideally help them go away. And again, you can also do the more lateral one that's a little bit farther lateral, same deal, okay? Or if you find one on the back of your jaw, say there's one on the back of the jaw, you simply take the head all the way to that side. So rotate completely away. Again, the two positions are extension, side bend towards, rotate away, and you have to continue to palpate or keep your finger on that spot until you feel that it turns off. So right there, that turns off, and we hold her there for up to 2 minutes. Trying to let that relax. I compress through the head. You can't see that, but my right hand is doing that. Okay, that's how you treat suboccipital headaches. Thanks, Drew.